Just tell us what's wrong, why you're here.
I have chronic jaw tension and pain, and I have bite sensitivity. All types of foods, eating them causes me pain. Crunchy food can cause severe jaw pain for 8 to 12 hours. I avoid all hard foods in general. I have hot and cold sensitivity, more cold than hot. So
does the pain linger, or does it go away real quick?
It lingers for probably 30 seconds after. So sometimes it'll last the whole. I avoid almost all cold foods.
So
I only drink hot beverages or room temperature.
So iced teas and out?
No, I never drink anything cold with ice.
What about chewing gum?
Every great once in a while for maybe 10 minutes, but then I'm like, it wasn't worth it. So.
Then why? Because your muscles
just starts
are sore?
hurting so bad. My teeth feel like, I know I told you this before, which is bizarre. It feels like the surfaces of my teeth are bruised. And after I've chewed it, all my teeth ache.
Okay, all right. What about at night? Is it worse? I can wake up clenching in the morning or anything weird like that?
No, I don't really notice a specific time that it's worse because it's always tense and it always hurts. So it's just if I've just eaten, it flares up.
Did you ever wear braces?
No.
You ever have a bunch of fillings done? Did it feel like the fillings threw things off? It's just
I've only had one little filling ever. So.
Okay, so at what age do you remember this problem starting?
I had it once when I was in high school, and then not again until my mid-30s.
Got it.
Early 30s, I would say.
Okay. Open. Try it home. When you clench hard, does that hurt a little bit?
Mm-hmm.
Where does it hurt?
All over the back. Well, all the way up to here on both sides.
How about the cheek muscles? Are they sore? Can you do that?
Yep. Yes.
Okay, open for me. Close down. Back here, is that tender?
Mm-hmm.
Open. Close down. How about way back here?
Mm-hmm. Yes.
Which is worse, or about the same?
The right.
The right's worse.
Mm-hmm.
Okay. Right. Now, bite home really hard. 1, 1, 2. Now go left and open. Perfect. See your left side back here? 30%? Way skewed. Way high. You're also skewed back over here off to the side. The time it takes you to chew is excessive slightly. Not terrible though. And then as you start swinging off to the side, you are rubbing the Jesus out of this back molar here. That does not belong. That's a problem. This kite should be heading towards number 11, which is your canine. If you'll remember in those videos, I talked about how canines separate back teeth. You don't have that going on. The back molars have these really special nerve fibers that go straight up to the brain, to the muscle, talk right back, and they want, so the brain's telling the muscle, I want that bump to go away.
Right.
So you're always tense and always clenching. This is what today's like. I'm in there, I'm very precise, I'm in and out, doing that, adjusting, double, triple checking myself. What's that feel like subjectively? Different?
It feels different, yeah. I feel like it's not hitting as hard in the back.
Okay. That looks better already. Kind of like it actually.
Well, it feels a lot different when I have my mouth go to the left, so it's hugely different.
Yep. And see, this is significant. The amount of time it takes you to close together to go home is 0.15 seconds, right? The amount of time it takes you, your back teeth to separate as you swing to the left is now 0.27. You were way over a second. 1.2 initially.
Yeah.
When you were dragging to the left,
Yeah.
now all of a sudden it's like
Yeah.
the flash, you know what I'm saying?
Yeah.
And your muscles aren't working as hard.
Right.
So that's like wicked cool. That's what's going to make them feel better.
Wonderful.
What's it feel like?
It feels good. I think the only thing that I feel is like this right up towards the front, it's hitting harder than it did before.
Oh yeah.
So.
That's one of the goals.
Okay.
That's actually ideal.
Good.
Yeah, it'll wig you out for about a week.
Yeah, it feels weird.
Yeah, yeah.
But
That's okay. Don't let it scare you.
okay.
Give me some cold water. Cold water. If we have ice, put some ice in it.
The test.
That's right.
Scary ice water.
Yeah. Lethal, right?
Yes.
Lean back for a sec. Open for me. Close down. Is this still sore?
Just a little bit.
Maybe 60% better. Is that fair?
I'd
50?
say, yeah.
Okay. How about up here?
That feels a lot better.
This was really bad in the beginning, right?
That feels a lot better.
All right, let me...
Can you sit her back?
No. I want to try something. She knows exactly what I'm going to do.
It didn't hurt.
Didn't hurt?
That's crazy.
No way.
That always hurts.
Ice water, right?
I don't do ice water.
Well, you are now.
That's crazy.
Put some water in there. Just leave it there for a second. I just to see if I can really torture you. Nothing?
No.
Oh, come on.
Okay, with the ice cube over there, yes, I feel.
Okay, well, yeah. That's normal. Yeah, but how cool is that, huh?
That's pretty cool.
Yeah. Without medication.
That's crazy.
See, and the hypersensitivity, the real sensitive teeth, like the hot and cold thing you were talking about, the teeth are chronically inflamed. They're irked. I mean, you've been whacking the piss out of them for years in an unstable manner. Things are not balanced. Consequently, you have a blood supply and you have nervous tissue that feeds the inside of that tooth. The inside is living. It's alive. It's living. When you have a chronic inflammatory response, it's ultra sensitive. It's just really, don't touch me, don't touch me, don't touch me. That's why you get this thermal response. Now, what have I done? What have I changed? I have changed the amount of force over time, and I use the paper to find the wear. And I've relieved all that, and I've made things more even. So all of a sudden you're drinking cold water, and the pain is gone.
Yeah.
How cool is that? Why? Because the chronic inflammation, it's gone. You should be able to go home and chew gum now, if you couldn't before.
That's crazy.
Did you before?
Like I said, I mean, maybe once a week, but it's very short.
And it was just
I'm
driving you
I'm done.
batty. Yeah. So between now and next time I see you, please chew some gum.
Okay. I'll do that.
Tell me what you see.
Okay.
All right, we're basically done.
Okay.
So you want her back for
Thank
filling?
you.
Yeah, yeah.
And